A law that will save lives. That's how mental health advocates described Travis's law when it was signed in 2021.
Yeah, it's named for a Minneapolis man who was shot and killed by police, and it requires 911 dispatchers in Minnesota to refer callers in crisis to trained mental health response teams. But investigative reporter Kirsten Swanson discovered that's still not happening in some parts of the state.
Kevin Lindsay, our reporting has uncovered counties that didn't send any crisis teams to any mental health calls after the law was passed. In one rural Minnesota community, the family of a mentally ill man believes that failure to follow the law had deadly consequences.
I love looking at his art.
Inspiration is found in the most unlikely places. For Brent Alsleben, drawing offered him a way out of his own mind.
Some of Brent's most amazing art came from when he was unmedicated.
In 2011, Tara Sykes noticed a change within her eldest son.
He just had these wild thoughts and visions and believed he was fighting demons.
His mental illness quickly escalated. Tara says a crisis team responded to the family's St. Paul home when Brent harmed himself with a lighter and knife. They took him to the hospital, where a doctor diagnosed Brent bipolar schizoaffective.
That day, I witnessed how things are supposed to work.
For more than a decade, Tara says her son was stable. Brent began taking medication and moved to his own apartment here in New Auburn, a small town an hour west of the Twin Cities. But in the fall of 2022, Brent's father, Clark, died.
He really spiraled.
Stacia Alsleben says her older brother cut off contact with everyone.
Brent has never, ever shut me out before.
His family, desperate to reach him,
Sibley County 911.
called for help.
Hi, my name is Tara Sykes. I am Brent Alsleben's mom.
5 investigates obtained 911 call recordings that show over the course of 4 months, the family called the Sibley County Sheriff's Office 8 times.
He has a history of burning himself. He's done it twice. He has a history of not eating. His psychiatrist called and was said that it was urgent, that he needs to go to the hospital.
Each time, they told dispatchers that Brent is mentally ill and in need of treatment.
We're just so worried, and he needs help so bad.
Okay. And he's not willing to go with you to the hospital?
He's not even willing to talk to us.
Okay.
No.
He is beyond delusional at this point, and we are 100% convinced he is going to try to take his life.
Jay Sykes is Brent's stepfather.
We've just been running into walls over and over, but now it's at the point where he's going to die if he doesn't get in the hospital.
All right, we'll go up there and check on Brent, okay?
Every time they called, dispatchers sent sheriff's deputies to check on Brent. Just deputies. We reviewed records that show Sibley County never sent or requested the assistance of trained mental health responders.
We needed somebody in the professional realm to help out.
And in Minnesota, that's supposed to happen. A year earlier, the legislature passed Travis's law, requiring 911 dispatchers to include a referral to mental health crisis teams where available. And those teams are available in every county through a program sponsored by the state's Department of Human Services. But a 5 Investigates review of state data revealed law enforcement in 9 counties didn't refer a single case to this established network of mobile crisis teams in 2021 or 2022. One of those counties, Sibley County.
How can that happen?
Deb LaCroix-Kinnery is a mental health advocate who offers training on Travis's law to everyone from community members to county officials.
Is there anyone overseeing implementation on an official level?
No, there's not. And we need to have somebody monitoring this and offering help, quite frankly, as a resource to help them get it implemented.
5 Investigates sent multiple requests to Sibley County Sheriff Patrick Nienaber asking about his department's policy on dispatching mental health responders. He declined an on-camera interview. In a statement, the sheriff wrote that response to mental health calls has and always will be a priority for this office. But when asked for more specifics, he never offered any details. So we went to Sibley County to try and get answers from the sheriff, approaching him as he left a Board of Commissioners meeting.
We really have a lot of questions about how your office handles mental health cases.
I issued a statement, Ms. Swanson, and that's what I'm going to stand with.
Can you tell us if your office has a policy around when to dispatch crisis responders?
We have trained our staff on that. We have trained our deputies.
But do you have
We have a
crisis
protocol.
responders?
I don't
Can you
want to
tell
do it
us
on
what
camera.
that
with you.
is?
Sheriff Nienaber also didn't address his office's response to the calls about Brent Alsleben.
Is there a reason that you didn't dispatch crisis responders in those cases? All the times his family was calling? You're not going to answer any of our questions?
No, I'm not.
Is it surprising to you that 2.5 years this has been in the books and that some counties are still not doing this?
Actually, I'm shocked, quite frankly. If they're not doing it, there needs to be some kind of accountability there. If you or I don't follow a law, there is a consequence for it.
For Brent Alsleben, his family believes the failure to follow the law had deadly consequences. On December 14th, 2022, Tara made one last 911 call.
Sibley County Sheriff.
Hi, this is Tara Sykes.
Days earlier, a court granted her guardianship of Brent. On that cold winter morning, the family went to his apartment with a Sibley County deputy to take him to the hospital.
Everything just spiraled out of control.
Investigators say when EMS and the deputy tried to restrain him, Brent stabbed a paramedic and barricaded himself in the apartment.
Please come out.
An hours-long standoff ended just after midnight when a SWAT team went in. Investigators say officers found Brent crawling on the floor with a knife. During the struggle, he stabbed an officer. And as the 34-year-old tried to stand up, 3 Hutchinson police officers opened fire. Brent died at the scene.
I'm angry. I'm sad. They got to go home to their loved ones. I never get to hug my son again.
I believe that if Travis's law would have been followed, if they would have sent a mental health professional, someone trained to deal with individuals who are disabled and or mentally ill, that Brent could be sitting here talking with us. Simple as that.
The Sibley County Attorney's Office ruled the use of deadly force justified in that shooting and declined to file criminal charges against the officers involved.
Now, those other counties, did you get any information why they didn't call crisis teams in for those calls?
Yeah, we got a wide variety of responses when we reached out. Some counties, like Cook County, are actually developing their own crisis teams, so they don't use those state contracted providers we told you about. But others told me they're still sending law enforcement to these calls. One sheriff who recently took office said he didn't even know that this was a law. Mental health advocates say that inconsistency, guys, really underscores the huge problem with this entire system, and they believe it's going to take the legislature stepping in to address it. The family's pushing lawmakers to clarify the law a little bit and also add some additional protections when it comes to alternative response. We have more information about those efforts in our story that's online right now at KSTP.com.
Well, powerful and tragic story about what can happen.
Right.
Exactly. Yep.